What is your perception regarding the effects you have on patient outcomes?
I think for the most part, my perception is of the patient outcomes is that the treatments are positive. I think most patients are helped and improved by the type of things we do. We do so many different types of procedures throughout, all sorts of patients, whether it's getting a biopsy of something to find out what it is in order so a patient can be properly treated and diagnosed, putting in port for someone to get chemotherapy so they can get cancer treatment. Sometimes we do ablations or put needles that can get really hot or really cold into tumors and kill them and cure cancers. We can do nerve blocks for pain management. We can stop bleeding and internal bleeding in the middle of the night so that patients who may be at a postpartum hemorrhage can be able to spend time with the baby they just delivered. I think a lot of what we do is very positive, and I think patients would agree.
Do you have suggestions or recommendations as to how teamwork and collaboration can be improved between your profession and nursing?
So in terms of suggestions for improvement in collaboration and teamwork, I think the main point is that everybody maintains an open dialogue and is free to or comfortable to communicate things in a safe setting. Oftentimes, people become scared of conflict or worried that they're not staying in their lane, so to speak. But patient safety is something that really doesn't have any lanes. And if things can be improved and we can make the patient experience safer and better, then by all means we need to have discussions. I've at times tried to administer a medication or put a dressing on where maybe someone had an allergy to that type of thing. And, I'm focused very heavily on the procedure I'm doing, and I can't always have those things in the front of my mind. Good nurses always speak up, and I'm never offended or hurt by someone saying something to me that's going to actually make a patient safer and better. In fact, I encourage that type of thing. Whenever we as physicians see room for improvement in our team, either our nurses or our technologists, we always feel free to give them constructive feedback and ways that they can improve, but that has to be done in the appropriate setting, has to be done in a place where both parties feel comfortable. It's never in the middle of a situation where people could be embarrassed or offended, but if we're in a sort of a team meeting or a huddle where we can talk about things, where things are safe, or if we can have a one-on-one conversation, I think that's always the best. Another thing I think we could do is open up more opportunities for nurses to get involved in doing the things that they like. Some nurses really want to work more with their hands, and we can get them doing more procedures, things like IVs or PICCs, or maybe even some suture work or some minor procedures. We also can extend kind of our environment into the other specialties that we interface with a lot. We work a lot with oncology, GI, and surgery, and we often have a chance to discuss our cases with those nurses, and it's good for them to have an understanding of what we do, and simultaneously we get to find out kind of what they do and just ultimately make the patient experience better.